Hi, today's video is going to be about anxiety in kids, what it looks like, and a couple of the features of anxiety in kids that you may not be identifying already. So first off, when you think about anxiety, especially what it looks like in kids, you probably think about things like nail biting, clinging, difficulty separating from parents, staying up late at night, things like that. There are also some other features of anxiety that you might be seeing in your child. Other signs of anxiety are hitting, running away, overly compliant, meaning just saying yes to everything and agreeing to everything. A shutdown, so basically shutting down, no longer talking, no longer interacting. Being overly agreeable. This goes along with the difficulty or inability to make decisions. So if you ever ask your kid what they want to do and they're like, I don't know, I can't decide, those can be features of anxiety. The fear of making a decision, fear of judgment that can come with making a decision can lead to being overly agreeable or compliant or just not being able to have an opinion. Um, so the reason that you see such a variety of behaviors coming from an anxious response is because anxiety comes from the body's threat detection system. So when your child is dealing with anxiety, what that really means is they are on high alert for danger and their brain is signaling danger at all times or in specific situations. So what I mean when I'm talking about that threat detection system, that's that you've probably heard of fight, flight, or freeze. There's another one called fawn, which is come out in the research lately, which is that kind of more agreeable, people-pleasing response, which is also a threat response. So what I really want to talk about today is asking yourself, when you see some of these behaviors that I've listed in your child, asking yourself, is this a fear response? Is there something that my child's afraid of right now? You know your kid best. You probably are watching this video if you're kind of suspecting that they have anxiety or they are exhibiting a lot of fears around certain situations. So if you think that your child's experiencing anxiety, I would encourage you to talk to a mental health professional. I would encourage you to look at child therapists in your kind of local area and see if there's anyone you can reach out to learn more about this. I also have a blog post on this with more information. So if you're listening to this and you're thinking, oh, yes, I am seeing a lot of this in my child, or I didn't realize that when they're acting out or when they're hitting, they may actually be scared or they may actually be having a threat response, just kind of give yourself permission to do a little bit more searching because chances are your child needs you and needs help expressing that what they're really feeling is a sense of fear and maybe even an overarching sense of anxiety. So I do have another blog post on what to do when you think your child is in that fear response. And so a few tips from that I think are helpful today are just, if you do think your child is having an anxiety response or a fear response, thinking about safety first. Their body is telling them something's not safe. Whether or not there really is a threat, they think that there is, right? And so the best thing that you can do is validate that they might be feeling a little bit fearful or anxious, and then try to activate some strategies that can help them feel safe, whether that's just a softer vocal tone from you, whether that's, hey, let's get out of this situation for a minute, or let's go for a walk. Anything to kind of get their body in a space that helps them feel more safe will help bring them out of that fear or anxiety response and help bring them back to a baseline, hopefully, of regulation. So again, big takeaways are asking yourself if you see a behavior that's underneath that fight, flight, freeze, or fawn response, asking yourself, is there something that might be activating a fear response right now? And if so, how can I help my child feel more safe and validate that there are ways to do that?